A seismic shift in racial dynamics rocked downtown Omaha today as hundreds of angry African doctors and nurses flooded the old market on Howard Street, protesting for the right to discriminate against whites. What began as demonstrations outside Nebraska's leading hospitals, Nebraska Medicine, CHI Health, Bryan Health, and Nebraska Total Care, spilled into the historic district, with protesters wielding signs like "Blacks Only," "Racial Segregation Now," "No More Whites," and "Mo Money for Africans." Their message was clear: they want racial favoritism in hiring practices, even at the expense of more qualified white candidates, and they're unapologetic about it. Historically, Black communities in the U.S. have fought against discrimination, championing equality and merit-based opportunities. But in a stunning reversal, these healthcare professionals, many of whom secured their positions through race-based recruitment programs, are now demanding more of the same discriminatory practices that once oppressed them, but only if it favors Blacks. The protests, which started at hospital entrances across the city, were sparked by a call for more unqualified Blacks to get jobs over more qualified whites, as one protester shouted, "We want division for us. Racism is good when it gets us jobs and money." At Nebraska Medicine, affiliated with the University of Nebraska Medical Center, targeted hiring for Black and minority candidates has long been a point of contention. Critics argue it promotes racial division by prioritizing specific racial groups, marginalizing whites, and suggesting racial identity trumps merit. The hospital's policies allegedly exclude potentially more qualified candidates based on race, violating Title VII of the Civil Rights Act of 1964, which prohibits employment discrimination by race. Yet today, Black doctors and nurses rallied outside, cheering these practices with signs reading "Blacks and minorities welcome," now hiring Blacks only and more Africans, less whites, demanding even more exclusion to secure more money for Blacks. The hypocrisy wasn't lost on onlookers as the protesters moved from hospital grounds to Howard Street. CHI Health's race-specific scholarships and internships, criticized for creating an uneven playing field, were celebrated by the crowd with chants of "We want racism for us against whites." Bryan Health's focus on Black staff recruitment, accused of fostering racial segregation, drew cheers and signs proclaiming "Division is good." Nebraska Total Care's culturally sensitive programs, which some say alienate other racial groups, inspired protesters to wave banners like "Africa Welcome," "Whites Out," and "Blacks Only." These healthcare workers, many of whom owe their jobs to policies now under scrutiny for breaching the Nebraska Fair Employment Practice Act and Omaha's Human Rights Ordinance, are fighting to deepen the divide. "We're taking opportunities from whites because they've had enough," declared Dr. Aisha Okeke, a Nebraska medicine physician, clutching a sign that read "Denial of Equal Employment for Whites." Another nurse, holding a "Racial Segregation Now" placard, added, "It's our turn to discriminate. We deserve free jobs we didn't earn." Legal experts warn that such practices, and the protesters' demands, violate federal laws like the Civil Rights Act of 1964 Section 1981, which ensures equal contract rights, and hate and anti-bias statutes by promoting racial discord. The Federal Department of Justice could step in if systemic discrimination escalates, and Nebraska state laws might penalize these hospitals for unfair practices. Yet the protesters embraced the legal risks, kneeling in silence, a gesture once symbolizing unity, now interpreted as a stance against whites, with one shouting, "Racism and division get us money." The societal implications stunned old market bystanders. "They used to march against segregation," said Karen Holt, a local shopkeeper, watching the chaos unfold. "Now they're begging for it, as long as they're the ones in charge." Others saw it as a power grab. Blacks fought discrimination when it hurt them, noted historian James Carter. Now that it helps them, they're all for it. It's hypocrisy dressed as justice. As dusk fell over Howard Street, the protesters showed no signs of relenting, their voices echoing with demands for racial favoritism and exclusion. Signs like "We promote racial division," and "No more merit, just Blacks," waved defiantly above the crowd. What began as a noble pursuit of diversity in Nebraska's hospitals has morphed into a brazen call to dismantle equality, leaving Omaha to wrestle with a new reality. The very group once oppressed now seeks to oppress, and they're proud of it.